Qualcast Nation, because of the demand, because of the need, we brought back Jenn Pike. Welcome back to the show, young lady.
Thank you so much. Thank you for calling me a young lady, and thank you for having me back on the show.
We would be remiss. The content you've been throwing down, I gotta say, if you guys, we mentioned this before, but follow her on Instagram. Great content in an entertaining fashion. She's got loads of content, loads of programs that you're going to hear about, and just winning the game when it comes to informing the masses when it comes to perimenopausal and menopausal health. So, Jenn, listen, I think I want to start us off by, since we last spoke, there has been way more energy and attention when it comes to perimenopausal health. And where are you feeling about all this? Are we moving in the right direction? Are our patients, our clients, are they getting what they need to thrive again?
I think we are definitely in a better place than we were 5, 10 years ago. I also think that we do what happens in industry, which is where we see opportunity and now we're being overly marketed to. And I think that this is where it's like we kind of hit that slippery slope where we're in such an incredible position right now to enhance the education and when you educate a woman and you empower her, I mean, she's unstoppable. Women are brilliant and wise by nature. And I'm a firm believer that if you empower her and give her the tools about her body, she's not going to forget them and she'll be able to move forward in a better way. Where things are a little bit kind of slippery right now is we are being sold to every single day that you need to own this item and this thing and inject this and take that. And it's like there can be benefits to things like peptides. There to a weighted vest. There can be benefits to, a biohacking tool. I always come back to the question of, have we taught her the boring basics foundation of her health yet? Does she understand how to optimize digestion? Because the changes that her gut microbiome are going to go through in perimenopause are massive and they will impact her energy, her cognition, how she shows up in the world, how she breaks down food that she's absorbing, her body weight and composition. Does she poop every day? Is she sleeping? How are we supporting her liver? These are the things to me where I've been in this industry. I'm in my 29th year in this industry, my 25th year in clinical practice. I started in clinical practice in 2001, and I've sat back and watched every fad, every diet, every movement, moment, thing happen, and we are in it right now. And if you're a woman that is between the ages of like 35 and 65, you are the target market. And so there's a lot of incredible resources out there. We've never lived in a time where we have accessibility to more free education and knowledge, but we also have more noise than ever before. And it gets very hard as the woman sitting there trying to learn what is best for me when you're being yelled at essentially every day on social. Eat this, don't eat this. Move this way, don't do that. Fast, don't fast. Cold plunge, never cold plunge. Do this, don't do that. And you're just sitting there like, I don't even know what to do. Most women don't even know what to ask in terms of their blood work from their doctor, let alone what the next step is. So I am very excited and hopeful where we are at for someone like me, where my throughway is education. If I leave this planet and I can turn around and look back at my life and people will say the way she taught and connected women to their bodies was like no one else, I will have done a good job. That and raise wonderful. But that is my whole thing, is through education. So I think it's an exciting time, but I also think it's a time where a lot of people are going to get lost.
And how do we avoid this, Jenn? I must say, I mean, we've been talking about perimenopause for a while and menopausal health, and you're right. There's a lot of noise right now. I probably, until you mentioned it before we recorded, didn't fully digest the amount of noise. And I'm just kind of thinking about it now. Like, I remember, as you mentioned, cold plunge. I remember someone saying what temperature is ideal for cold plunging. I'm like, Jesus Christ, like, we walk before you do a marathon, you know what I'm saying?
If you
And so
dip your toe in and the rest of your body recoils, that's cold.
exactly. So maybe at a high level, like what do we do about this? Like, how do we sift through the noise if you're an average perimenopausal woman?
I think the first place to start is you have to know yourself best first. And how you can do that is, you and I talked about this on a recent interview with each other. If you can stop looking at what everyone else is doing, what they're using, is working or not working for them, and you can first sit with yourself and ask, like, how am I actually feeling? Like, do I get good quality sleep? And if I don't, why could that possibly be? Like, do I have young kids still that are up in the night? Do I have a dog waking me up? Do I really have trouble sleeping, or do I have environmental sleep issues? Meaning my partner snores, someone's waking me up, and it's not me. Like, I'm an example of that. I have no problem sleeping. I sleep beautifully by myself. But I have teenagers that come and go at different times. I have a husband that might wake up to go to the washroom in the middle of the night or comes to bed later than me. So the woman, I do not have a sleep problem. I have a people problem. And so when people ask, like, what stage of perimenopause are you at, Jen? I'm like, I'm at the stage where I'd like my own place. Like, I would like my own room.
You and Kathy would get along very
Yeah.
well, by the way.
And soundproof it. So sometimes it's also like asking yourself, everyone will say, I eat pretty healthy. Okay, let's go deeper on that. Is there color in your diet that's real food? Are you getting enough fiber? Do you actually eat? Most women who come into our practice and our programs, they have been lost in the last decade of fasting principles, which fasting can be wonderful for certain people and certain bodies and certain lifestyles, and detrimental for others. And the thing is that if you are a woman where a lot of them will say, like, I love it because in the morning I don't have to think about what I have to feed myself. I can just, have my coffee and I can move into my day. And then I push my food closer to 11 or 12. Well, a few things that I would ask around that is I would say, what if I took the coffee away and you could only have water in the morning fasting? Would you still be able to fire on the cylinders you needed to get through the morning, get the family out the door, get to work, start